So we're here today. I have a male client. We're going to do PRP, and we're going to do it here in this area where you see it's kind of thinning out. And what I'm doing now is applying some local analgesic ointment. This is a benzocaine, lidocaine, tetracaine mix. And we're just going to numb the area some before we start getting started with our PRP process. While our client is numbing, we're going to prepare the kit. This here is heparin. We want to apply some heparin to the kit where we're going to spin down the blood so that we can extract the platelet-rich plasma. And the heparin is just going to ensure that the blood stays thin and it doesn't clot while we're spinning down the kit. Okay, and for this particular kit, I'm going to draw back 8 cc's of heparin. I inject 2 into this port here. And then when I do the venipuncture procedure, we'll have the heparin in the syringe so that his blood doesn't clot when I'm preparing a kit. Okay, so what we're going to do now is the venipuncture procedure, and we're going to go for this vein right here in the AC. And I'm just going to clean it first with alcohol and a betadine solution. And I let the betadine dry a little bit. Okay, and this is the syringe that has the heparinized solution in there. And this is the little vacutainer needle that I'm going to insert to get the blood. Okay, you're going to feel a little pinch. That's it. And for this particular kit, we are going to draw back 60 cc's of blood, which is similar to about 6 vials that you may take in a doctor's office when you're drawing blood. And his blood is flowing nice and well. So he got good veins, and I did make sure that he was hydrated. You okay?
I'm supposed to talk?
You okay?
I'm good.
Okay. Always want to make sure you check on your client to make sure they're okay.
I'm good.
So this is the 60 cc's, and I'm just going to release my tourniquet. I'm going to take the 60 cc's of blood, and I'm actually going to insert it into the kit so then we can spin it down and separate out the platelet-rich plasma. Now when you're transferring it, you want to make sure that you're not applying too much pressure because you don't want to hemolyze the blood cells, so you just allow it to kind of gradually go into the chamber, and you don't want to apply too much force. Now that we have the blood into the kit, what we're going to do here is put it into our special centrifuge that is going to spin down the blood, and it's going to separate out the platelet-rich plasma. So stay tuned so that you'll see our PRP after. The centrifuge finished spinning down the blood. This is the end result. You see here in this chamber, we have the blood cells, which we will not use. Here is the platelet poor plasma, and that buffer in there, that's the platelet-rich plasma. Now, people may be wondering why we have blood in this chamber, but this particular machine, it takes any blood cells that are rich in PRP, and it pulls them over also. So we do get a thin, small amount of blood cells with this, but that's because we want to get as much PRP as we can. And with this particular machine, we actually yield about 10 cc's of PRP from 60 cc's of blood. Now what we're going to do, we're going to actually extract the platelet poor plasma, and then what we will be left with is the platelet-rich plasma. And now what I'm doing is extracting the platelet-rich plasma. It does have some blood cells attached with it because there is platelet-rich plasma within those attached to those blood cells. So we will get a little tinge of redness. The method, what I'm going to do with the small 30-gauge needle is inject the platelet-rich plasma underneath the skin. Okay? You okay?
You ain't start nothing yet.
Oh, wait. He's numb.
No, I can feel them pokes in my head. I want you to be relaxed.
Oh, I'm relaxed. I'm very relaxed. I just want to make sure that you're not having too much discomfort. What we're doing is just applying some platelet-rich plasma underneath the scalp, and this is the first method. So now what we're gonna do is we're gonna do microneedling. I just did some needling of the PRP underneath the skin, and I just kind of coated the scalp. Now we're gonna do microneedling. Microneedling has multiple needles, and we just want to ensure that we're getting the PRP down to the epidermal layer so that it can activate the inactive hair follicles. How you doing? You okay?
Yeah, I'm good. Like you say, on the crown of my head again. This is where you feel it
The most.
the most. Yeah. But I guess that makes sense. How does the skull work? The skull. I'm trying to think of what part of it.
Well, it has to do with your nerve endings, just where you're more sensitive.
Oh, okay.
So now we're focusing on the front part. We did do the back. Now I'm going to do some needling on the front part. You okay?
Yeah. This is what people be oohing and on about?
Yes. Everybody's pain tolerance is different. Luckily yours is high, so we're doing a great job. What we're doing right now is we're working on a hairline because this client does have a little pocket here that he wants to regrow this area of his hairline.
Stephen A. Smith, come holla at the girl.
That's right, we'll get your hair back naturally.
Delicate procedures here going on.
Now we're just doing some micro needling right here where the hairline is so that we can stimulate and activate these hair follicles so that they'll continue to grow and fill in this little area. And as you see the blood here, this isn't blood where he's actively bleeding. This is actually where I applied the platelet-rich plasma with some blood cells thin on the scalp. So that's where you see the blood. And now we're just going to work it into the epidermal area so it can activate the hair follicles. We're going to do a sapunctate method, and this is just a small 30 gauge needle that's a certain length, and it's going to make sure that it gets down in the epidermis everywhere that I actually inject. So this is the third method that we use in our PRP treatments. Now what I'm doing is just I'm massaging, and yes, PRP treatment does come with a head and scalp massage. I'm just making sure that we're massaging the PRP into the epidermal area so it can really get down there and activate those hair follicles so they could stimulate them to grow. And Andre did a very, very good job with handling this treatment very well. So thank you, Andre, for being a great client.
Oh no, my pleasure. And she was very good. Regina, Dr. Regina. We're calling her Dr. Regina. She did her thing. Made it bearable. The consultation was great. And you followed through. I gotta be back in 6 months.
6 weeks.
I mean 6 weeks.
Not 6 months yet. And Andre's gonna have a series of 2 treatments. We do them 6 to 8 weeks apart, and then we also support it with some vitamins and also some hair substance after to block the DHT so it stops further thinning and balding. So, you know, contact us at Platelet MediSpa for additional information and for a free consultation. Thank you.